Of course, there are many benefits to breastfeeding. As far as baby goes, they have a stronger immune system, so less likely for infections such as ear infection, respiratory infections, gastrointestinal infections, less likelihood of SIDS. And as far as mom goes, it actually has been proven to decrease her risk for breast and ovarian cancer. And it's a great bonding time for mom and baby as well. And we encourage everybody to breastfeed. However, there are some women who can't breastfeed, or they've tried everything they possibly can and they can't produce enough milk. And I just never want anybody to feel like a failure if they can't do it, because there are some women who can't. And that's okay, because at the end of the day, as long as baby is fed and loved, that's all that matters. After delivery, as long as you're stable and baby's stable, we're going to encourage that you breastfeed, shortly within that first hour after delivery. So before grandma and grandpa get in the room, before baby's first bath, we really want you to do some good skin-to-skin contact and start nursing baby right after delivery. Breastfeeding is actually quite the perfect system, and how it works is based on supply and demand. So the more you nurse, the more milk you're going to produce for baby. So it's really important, especially those first couple weeks of life, as your milk supply is getting established, that you and baby just work together, building up your supply where baby needs it to be. And so there's going to be times where that's all you feel you're doing is nursing baby, but baby is working with you to get your milk to where it needs to be. Typically we say, nursing every couple hours during the day, especially early on, and then that will eventually kind of space out. But I really encourage women to not pump or do any of that stuff, no bottles, because that can interfere with your, how your milk comes in. And so, watching for baby's cues, they'll kind of start opening their mouth and looking towards food. Obviously, they'll cry, things like that. And you'll get to know your baby's cues the more, you spend time. And that's why it's really important that you and baby are going to be right next to each other all the time, those first couple weeks, but that's how that milk supply is established. Once your milk supply is established and those first couple weeks are done and you're feeling more comfortable with breastfeeding, you and baby have got your system down, and you're going to be heading back to work at some point and you want to start pumping, at that point then you can start pumping. Some women, pump a couple times during the day. Other women, just one pumping a day and start to build up their supply that way. You never really know how much you're going to produce until you start doing it. So you'll kind of be able to figure it out once you start pumping. But at minimum, I would start pumping, once a day if you're planning to go back to work, so there is a supply there. Of course, breastfeeding is natural, and it eventually gets to the point where it's easy and just how they show it on the movies, where you and baby are just bonding. But I will be completely honest, it takes a while to get to that point. Your nipples will be sore. You're trying to figure this out. Baby's trying to figure it out. Positioning, it feels awkward. Depending on, some babies take to it really quickly and other babies take a little bit longer. And so I think the more support you have, the more education you have about some curveballs that might be thrown your way during that early part of breastfeeding, the more likely you're going to push through those challenges that might come your way. And they have breastfeeding classes through the hospital that you can sign up to take. There's lactation support in the hospital while you're in the hospital. There's support groups, that you can make appointments to bring baby to after baby's home with you as well. You can absolutely expect to have some nipple soreness with breastfeeding, especially if this is your first time breastfeeding. To be completely honest, it will hurt a little bit. But that's why it's so important when you're in the hospital that you get good help in making sure that you have a correct latch. Because if you have a correct latch and you go home from the hospital feeling good that you're doing it correctly, I promise you the nipple soreness will get better, but it takes time. The American Academy for Pediatrics recommends exclusive breastfeeding for 6 months. And then once you introduce foods into baby, that you continue to nurse up to at least 12 months of age. Oakdale ObGyn does have several clinicians who specialize in lactation. So once you get home from the hospital, if you have any questions or concerns or want a little extra help, you can always call and make an appointment with one of those clinicians.